I even drove up to the Olympic.
We're live.
Do you want to start with the prayer first? Or?
We'd like welcome in prayer and say hello.
Okay.
Oh, and there's your water.
Yeah.
Is that you?
I won't touch it. Okay. Good morning. Welcome to our Summer Adult Forum Series. This is our second week. We had our introduction last week. Today's topic is foster care and adoption. As part of some of our sessions, we wanted to cover the resolutions that were passed at annual council back in February. So today's topic is representative of one of those resolutions. So I wanted to just open us with a prayer. It's a prayer out of the prayer book for the care of children. But as I read this prayer, if you have friends or family that are fostering children or that are in that process, maybe you would like to add their names in the comments section, and we could certainly pray for them. If you know parents who are waiting to adopt, or if you know families who are in danger of losing their children, please submit maybe first names only, and we'll add them to our prayers this morning. The Lord be with you.
And also with you.
Let us pray. Almighty God, Heavenly Father, you have blessed us with the joy and care of children. Give us calm strength and patient wisdom as we bring them up, that we may teach them to love whatever it is just and true and good, following the example of our Savior, Jesus Christ. Amen.
Amen.
Kathy Byars is going to come up and introduce our guest this morning.
Yeah, I was told that I had 30 minutes in which to make my introduction. I promise I'm not.
I'll see you on next week.
But Thomas is a graduate of Ole Miss in psychology. From there, he worked with the Harrison County Youth Court in Harrison County, Gulfport, Biloxi. And he then decided to continue on with social work, so he went to the University of Southern Miss and is now a licensed master's prepared social worker. Did I get that right? I made a note. He has since gone on and worked as referral coordinators with Clearview Treatment Center in Moselle, Mississippi, and he is now with Gatehouse Recovery Treatment based in New Hampshire, but he's not in New Hampshire. If he was, I would be too. Anyway, to paraphrase something that Josh said earlier this morning, when Godfather was speaking of his son at his baptism, he said, "This is my son in whom I am well pleased." And Thomas is my son. And I am well pleased with what he is doing and who he is. Okay, I just heard him sigh, so I'll be quiet. Thank you.
Hey y'all, my name is Thomas, and thanks for having me back. I got to come last year and speak on addiction and recovery, and so today I get to come back and talk to you a little bit about what our foster care system is like, and kind of where it's at, and maybe even encourage some folks to look into becoming involved with it, whether that's as a foster parent or in some other way. So I think it might be best maybe to give just a little bit of a kind of an overview of what is now Child Protection Services. Prior to that, it was the Division of Children and Family Services. It was under the Department of Human Services umbrella. Today, Child Protection Services is a standalone entity under the state. It does have an overall director that is appointed by the governor. From there, you have regional directors or area directors, one of those two. They split it up into the west and east sides of the state. Then from there you have regional directors, and then you have regional supervisors, frontline workers, and I think that the moral of all of that is there's a lot of bureaucracy, as there is with any state entity. So that's always fun to deal with, as anyone who's dealt with bureaucracy knows. And so it's a little bit of the overview. I kind of want to talk about some of the areas where we see like the most children coming into custody come from. So I think when you look at Child Protection Services, it is a very good representation of our state's demographics. The number one reason a child would come into custody is going to be for issues related to poverty. We are the poorest state in the union, and I do believe that the majority of people who come into contact with Child Protection Services are going to be people from those lower income brackets. So that will always be the number one cause. The number two cause is going to be drug use. So there is rampant drug use in our state as well as everywhere else. So kids will often come into custody over that. Reports are made daily of children testing positive at birth for one substance or another. They've recently passed a law within the last couple of years that children cannot be removed from parents' care for marijuana alone. So that is a big step for this state. I think before that we saw a lot of children come into custody solely because maybe they tested positive for marijuana at birth, or because their parents tested positive at some point in a drug screen. And so then the third cause is going to be for allegations of abuse. I think most often those reports are from over-discipline. So it is legal in the state of Mississippi to spank your child. However, it is illegal to leave marks and bruises. I believe that school systems and other agencies are most often responsible for making those reports because they will notice marks and bruises on a child, and they will ask the child, how did you get these bruises? And they'll tell them. So those are kind of the three biggest areas where you might see a child come into custody. Let's see, y'all give me some direction. What do I need to, what can I relay?
When you're talking about children that test positive at birth, and we know that comes from mom and her abuse of whatever it is she's doing. Do these children, do you take them as infants and then put them back with their parents, or do you take them at birth? and take them in custody are hard words for me to grasp, but does that newborn go on home with mom who's done whatever, or do they go into care?
So there's not an easy answer to that question because you bring up another valid point, and that is a decision for a child to come into custody at whatever level is ultimately left to a judge, and that judge is most often an elected, it is an elected position. In some cases, the youth courts operate under a county court system, which is, it's going to be like your chancery courts. Child Protection Services falls under civil court jurisdiction. So whether or not a child comes into custody, the department will make a recommendation, but ultimately that decision rests on a judge. And so it really depends on what the judge's feelings are in regards to substance use or over discipline. I would say that today, if a child were born and only tested positive for marijuana, the likely, and that was the only issue that was found during the course of the department's investigation, that child would most likely be released to the family and able to go home. I think that as you move up the ladder in substances, meth is a really big problem in this state. If a child is born positive for crystal methamphetamine, I think there's a stronger possibility that child is going to come into custody in some form or another. Of course, coming into custody does not automatically mean that a newborn or a child of any age is automatically going into a foster home or into an orphanage. A lot of times the department and the youth courts will look for family members or relatives who can take the child. But I think a lot of times what we see in Mississippi is the problems with a family that you come into contact with most often don't just begin with that generation. There is a generational problem that I think poverty continues to be the root of a lot of that. And so sometimes family members, extended family members, may not be an option. So at those points, children would go into a shelter or into a foster home not related to them.
Okay.
Yeah. Well, when you mentioned poverty again, that was kind of where I was most interested in hearing more about. I mean, some of those poverty issues that make children at risk. And I mean, tell us some more about that. Are there ways that the church or individuals could respond in efforts to address these generational poverty issues so that families are less at risk for losing their children? I mean, like, what kinds of things? Is it nutrition? Is it hygiene? I mean, what sort of, do you see what I'm asking? Mm-hmm. Yeah.
Yeah.
That was a lot, sorry.
No, it's fine. I'm trying to figure out how to answer it. So when you're looking at issues like poverty in this state and really other anywhere. I think that it's noble for a church community or other nonprofits to want to get involved and try and help in some way. But I think the truth is that on the micro level, which like family to family level, I don't know that any church or nonprofit out there would have the resources to really handle that. I think what I see more and more often, and I think that we're seeing a lot in the country right now, is the need for activism and advocating at higher levels of government. The issue of being able to afford health care is always going to come up. The issue of stable housing is always going to be an issue, and I think there is something that can be done at the state, maybe the local government levels, but I think it falls more on state and federal levels to reevaluate some of our practices when it comes to social welfare. We do not place an emphasis on social welfare in our country. It's very laissez-faire and very much kind of like a fend for yourself sort of mentality. And I think we have a notion of pull yourself up by your bootstraps, and if you want to do better, then you have that opportunity.
Right, but sometimes people that live in poverty don't have a pair of boots.
Correct.
So
Correct.
Makes
And
that difficult.
Yeah, and I don't think there's a very clear understanding of that. We think to ourselves, I think a lot of parents who become involved in child protection services and poverty as an issue, it's very reasonable to assume that education is going to be a leading cause of being in poverty. I think a lot of people you'll see that become involved with child protection services and the court system. They don't have a GED. They don't have any higher education, which restricts their opportunities in the job market, which leads to not being able to provide for your family. And so this problem with education is not as simple as John dropped out of school in 9th grade because he just didn't like school. John possibly dropped out of school in the 9th grade because his parents, his parents' parents, his parents before them, that's what they did. And there was never an emphasis on school. And that it goes back to that generational problem. Did that kind of answer your question, or did I just go off on a rant?
You're good.
Okay.
I didn't think it was a rant.
Okay. Yeah.
Can you say something about maybe how issues of race play into this foster adoption system we have as well?
Yeah.
Poverty is definitely an issue that kind of coincides with it.
Yeah.
I'm thinking like, we're putting all of this power in the hands of like these judges who, maybe have biases that they bring in.
Mm-hmm. Yeah, and I'm trying to figure out how to formulate my answer, not to be politically correct, but as a cogent answer. So let's start with the simple question of, does race play an issue? Is race an issue in this system? Yes. What does that look like? Well, I'll use my own personal experiences. So prior to going back to school and getting a little more education, kind of understanding things on a deeper level, I had unconscious biases that influenced my decisions and that influenced my beliefs. And I do believe that at some point I was subconsciously more biased toward people of color than I might have been to a white family. What that looks like is I would place my experiences growing up in my family of origin and what my family did and what I did. I would place those expectations and beliefs on another family without understanding, or even understanding's not the right way to put it. Without having at least some insight into what people of color might experience. I went through difficult times growing up. My family, my mother raised me by herself, and we were very fortunate that I had grandmothers, aunts, uncles, and people like that who had resources to kind of step in and help us along the way. And I don't believe that a lot of families, people of color, or minorities in general, maybe especially in this state, have had those extended family members with opportunities like that. I think that growing up, even though I got into trouble a lot, I was still kind of given the benefit of the doubt in some way, and that transfers, those unconscious biases, they transfer over into the legal system. I think it's really our legal system in this country is very interesting, and that is that we put a lot of responsibility on one person to make a decision that has significant impacts in a defendant's life, whether that is to go to prison or whether that is to remove a child from their family of origin. And those decisions are often based on our personal beliefs and how those beliefs are formed. And so it happens. I think even as someone who worked for the court system, as someone who worked for Child Protection Services, for a year, I operated, and I see others operate based off of their personal belief systems that aren't necessarily formed out of fact. They're based off of beliefs. And we know that beliefs aren't necessarily always the truth.
Do you think, like, for instance, a judge maybe that has this unconscious or implicit bias that two parents in the family are better, and so for this single mother, I mean, you know, that kind of, my belief system says that this single mother shouldn't have custody of her child or something. I know we were talking about race, but there are other ways that we have bias.
Mm-hmm. Especially in this state, yeah, like unwed mothers,
right,
young mothers.
Yeah,
I definitely think that plays a part, and I think what I was even among lower income white families, there is the culture among different socioeconomic brackets can be very different. So when you think about a judge, when I think about a judge, the image that I have in my head is an older white person, typically an older male white person. So you think about what being a judge means, and that is that person has a Juris Doctorate. They are very well educated. They are at the very least going to be upper middle class, which I think it's safe to say that most of the time those folks had more opportunities along the way. So if me as a poor white person from Mississippi comes into the courtroom because of poverty or drug abuse, and I'm not well dressed, I'm not well spoken, I think that definitely plays a role in someone's decision. Yeah, and I think it's hard to separate that, and it's really hard for someone to recognize that and take ownership of it. Because admitting that you've made decisions that impact families in such a way based off of your personal beliefs that aren't true, it's really uncomfortable. So I think it's a challenge maybe sometimes that people aren't up to. So.
You maybe starting with the point of a report being made on a particular member of the family, can you kind of take us through from the child's perspective, just through the process, like kind of this, what happens kind of step by step in their experience? Sure.
So everyone in here, everyone out there, everyone period is considered a mandated reporter. So what that means is if you suspect that a child is being abused or neglected, then you are obligated to make a report of that to Child Protection Services. That number is 1-800-222-8000. It's easy to remember. And so I call the hotline and I make this report. Say I'm a medical social worker, and child comes to the hospital for, I don't know, they're sick.
Whatever.
And I noticed, like, wow, that child looks really emaciated, looks really underweight. I've got concerns, the doctor has concerns, so the doctor calls me the social worker in. And I agree with their concerns. So we make that report, and it is assigned to the county where the child resides. So the department is obligated to make contact with that child and family between 24 hours and 72 hours after the report is made, depending on the severity of the allegations. So as a frontline worker, I received this report, and just for easy terminology, I'll refer to it as an investigation. And so I make contact with the family. If the child is able to if he's old enough to speak, then I will interview the child about the allegations. I will find out from the child what home is like, what the family's like. You know, I'll build rapport with the child to try and see what's going on. If I get out to that house and I have immediate, unquestionable concerns for that child's safety, then I will immediately call my supervisor, who will contact the court and request an emergency custody order for that child. And so I've done that. I got out there, the child was emaciated. There were just a whole lot of concerns. The child should have even been released from the hospital in the first place, because there were just a lot of health concerns. So within 48 hours of that child coming into custody, by law, you are required to have what's called an emergency shelter hearing. So at that emergency shelter hearing, the department, the social worker, the supervisor, they are, the burden of proof is on them to justify the need for that child coming into custody, and to make a recommendation as to whether or not that child needs to remain in custody. And if that child needs to remain in custody, there needs to be a clear understanding as to why. And so if the judge agrees with my recommendation that the child remain in custody, a petition will be filed with the court that basically lays out the reasons why this child came into custody. And the parents will be properly served, whether that's by a member of the court or by a process server. And the next hearing that we'll have is an adjudication hearing, which basically determines whether or not the allegations are true, or there is fact to them, or if there's not. And so if a child is adjudicated, you'll have another hearing called a disposition hearing, which is basically where the court, the department, and the family determine what happens from there. So you're often given a service plan, which is something the family works on to try and improve the situations in the household. And after that hearing, you will have what's called a permanency hearing or a review hearing. That hearing is not required to take place until at most 6 months after the disposition hearing. So a family has 6 months to work on that service plan and improve whatever the court, the department, and everybody identifies as areas of improvement. And so if they have improved, if they have made strides, they will, the court will consider returning the child. If they haven't, by law, they are required to determine the next steps. Oftentimes that can be to give the family more time if they're making progress, or the plan can shift to termination of parental rights. And so in those cases, the department will begin preparing all of the documents required. Start going through all the process of getting this. It used to be a packet about that thick of paperwork that somebody needed, that the department had to provide for termination of parental rights. And so it's called TPR. And so if TPR is something the court decides to pursue, they will start looking for an adoptive family. Oftentimes, it will be the home where the child has resided for 6 months. But they will continue looking for extended family members. The goal is to always have a child in their family of origin, whether that's extended family members or immediate family members. And
so in terms of like a percentage, how many kids are placed sort of into a foster situation, and how many are kind of given over to like an orphanage kind of a situation?
so we don't have any orphanages
Okay.
in this state. We have what they will call children's shelters. Those are temporary shelters, but we don't have kind of the stereotypical orphanage where a child might, live until they're 18.
Like a Charles Dickens novel.
Yeah. There's nothing like that.
But we used to, right?
I believe so. That was before my time.
Yeah.
So, I don't know what that looked like back then.
Are there children's shelters in each county, or are they all over the state, not associated with a particular county?
It's hard to say. I think there used to be one in Corinth.
There did, yeah.
I don't know if it's still there or not. The problem with shelters is that today they're required to be licensed by the state of Mississippi, and traditionally those shelters were in large part funded by county governments. So when you're starting to look at a licensed shelter facility, there are going to be more requirements. Your directors of the facilities are going to be required to have a certain level of education. You will, I'm sure that you're required to have some level of medical personnel on staff, stuff that gets really expensive. And it goes back to our emphasis on social welfare, and there's just not a strong emphasis on that. So I know in Harrison County we had a shelter that was not licensed forever and a day, and I think the state finally stepped up and said, we're not willing to work with this anymore. You have to get licensed, and you will not be able to have children here until you do. So yeah, it's a huge process that you're going through whenever you're getting licensed as a shelter, same as a healthcare facility getting Joint Commission accredited or Department of Mental Health accredited. It's a costly endeavor.
In terms of individual foster families, is that something that's administered by private organizations or by the government? We'll probably hear more about that in the next week's speaker.
Yeah, I know that there are private adoption agencies. That the one that I was always most familiar with was down on the coast, and I believe it was called Acorn Adoptions. And so that is a private adoption agency. But in terms of becoming a licensed foster home, I believe that's a process that has to go through the state. So that is something that anyone in this room, anyone out there in the world can do. But again, it is a process. And when you're dealing with bureaucracy, it is going to be a process. But it can be done, and it is a very awesome experience for people who are up to the challenge. And I think it is a challenge. So,
Thomas, I was wondering what the average length of time that the child is in foster care. Do you know by any chance?
There is no answer to that. If I came into custody because my mother had a drug problem, I come into custody because my mother has a drug problem, and she's like, oh my God, I've got a drug problem, my child's been removed, I've got to go do something. So mom just like gets on the ball, gets into treatment, starts working on herself, just really goes after it. I could be in custody for a few months, but if my mother doesn't do that, if she's just too sick in her disease, then her rights would probably be terminated. And the process of terminating parental rights and being adopted can be a very arduous process. It can take years. Sometimes children remain in custody until they age out of the system, which I believe they can remain in custody up to like 21 or 22, and then they'll be released from custody. So I mean, theoretically, you can have a child born into custody and age out of the system at 21 years old. And there are the reasons why that might happen are infinite. So, and those are always very challenging cases. I think typically those kids experience a lot in the foster care system. It's very traumatic.
Well, that's what I was also wondering. I mean, how common is it for a child to be moved from one foster family to another?
There are policies in place that try to dictate how many times a child can be removed from a placement and put into, and I can't remember what that policy is, it's been years, but it's a policy, and it doesn't take into account extraordinary circumstances. I mean, there are a lot of times children may have special needs in terms of there may be some form of disability that as a foster family I thought that I could handle, but then when I really get involved I figure out that I can't.
Right, it's like if you were taking care of an infant that was born with a drug addiction, that would be a difficult, possibly.
Yeah, a child born with special needs of any kind, that it might not be something I can handle. I think a lot of times in teenagers, they are very hard placements because oftentimes by the time a child is a teenager and is placed into the foster care system, they're dealing with so much trauma, so much baggage from their life that I think we automatically deem them as just bad eggs, and they're not bad eggs. They've just had a really rough go of it, but it's those kids can be hard to keep at home. Yeah. There's something I was going to say earlier, but I forgot. So, anything in the back there?
No, I'm just not much experience with foster care, except a neighbor 2 doors up just recently completed the adoption of a little boy that came to them as an infant from a drug situation, and I had lots of problems. And they had two sons of their own. And this little baby cried for about a year straight. I mean, they would be out walking up and down in the stroller in the heat, in the cold. He was screaming. And now, from all appearances, he appears to be a normal 2-year-old. But I'm sure there are lots of things underlying that. But what I can see just at a glance or at a distance.
Yeah, I think you bring up a good point, and it seems like no matter when a child is removed from their family of origin, that is trauma, and it is trauma that will stick with a child for a long time. And being in the foster care system is traumatic. I never grew up knowing that, I never grew up and knew that like I had a social worker, but children in foster care, they know that they have social workers. They come to understand why they have social workers.
Like these third-party people that.
That are coming to visit me at school. That come to my house. If I'm old enough to remember the being removed, if I can remember that, is very traumatic because I don't understand, I don't understand. And I think the question that a lot of child welfare agencies are asking themselves now is the trauma that we're placing on a child, is it going to be worth it? Is their home life that bad. I mean, like, are they going to experience more trauma as a result of coming into the system, or are they going to experience more trauma as a result of staying in that home? And so I think it's like you kind of have to weigh it out a little bit. I think that's really where a lot of my ideals started to shift, and I'm not optimistic that we'll ever do away with poverty or drug use in anywhere. So I think it's important to ask ourselves, like, do we really need to remove this child, or can the child stay in this home, and let's try to get these parents as much help as possible? And yeah, it's a tough question, and it's always a tougher answer. Yeah.
We have some questions on the live stream.
Oh.
Jaylene has a few questions. I think you already touched on one. Well, she was just wondering if you could speak to the numbers of children going into foster care with the family versus non-relative placements. That'd be a tough one.
Yeah, it's really hard that's always that is supposed to be their first avenue of exploration, is exploring family placements.
Yeah. And she also asked, you could probably speak to this one, is a newborn automatically screened for drugs, or does there have to be suspicion of maternal abuse?
In the county that I lived in Harrison County, which included Pass Christian, Long Beach, Gulfport, Biloxi, D'Iberville, Saussure, they pretty much every kid that was born was tested. They used to do it through their meconium, which, as I understood it, was the baby's first poop. And then they shifted to doing it through the umbilical cord blood. And Harrison County, the coastal counties are, the difference is night and day between where we are and those places. So just about every child that was born was tested, just as typical protocol. Yeah. But I don't know, I can't speak to what hospitals in this part of the state would do. I think where you have more urbanized areas in Mississippi, I believe that most children are probably going to be screened. In your rural areas, I think it's less likely.
Beth Bauer just makes kind of interesting comments. Her father grew up in an orphanage, and had a very positive experience with that. So I don't know, maybe relative, traditional orphanage situation versus the current system we have, where it's kind of like a network of fosters.
I have an interesting story about an orphanage. So I worked for DHS for about a year. And I always tell people that was long enough, because it was extremely difficult. People who work for Child Protection Services, they have a very, very tough job. So one of the very first cases that I had involved child-on-child sexual abuse. And the perpetrator of the sexual abuse spent the first 10 or 12 years of their life, maybe less, maybe 8 to 10 years of their life, in a Ukrainian orphanage. And so orphanages in that part of the world are very different from orphanages that that we might be familiar with in the States. there is, and there are reports and everything out there. So those children who come into Ukrainian orphanages as babies, they may just lay in cribs all day long, and the only affection or the only touch they ever get is when they're being fed and when they're being changed. So that leads to significant attachment issues, along with a host of other problems that can result from those
Like cognitive
cognitive issues,
learning disabilities.
sexual abuse, and those kinds of things. And that kid, it was always, the kid was adopted by a family in the Northwest and perpetrated sexual abuse on that family's biological children. And so was sent down to Mississippi illegally, where they did the same thing. And so I haven't been with the department like 6 months, and I'm sitting here on the phone with people in Washington, D.C., attorneys in the Northwest, and just like all of this just stuff that was way over my head, honestly. And yeah, I think about that kid a lot. Yeah, that's kind of my experience. Of course, it's not an orphanage in the U.S., but I think about that one a lot. Still do. Anything else from the interwebs?
No more from interwebs at the moment. Sometimes the questions roll in like a couple of minutes after the fact. So, but I think we're going on an hour, so I can stop the live stream whenever you want.
Okay. Well, I hope. Is there any other questions? Anything that I said that was kind of vague that needed follow up?
You did great.
Thank you.
So good.
Thank you.
I'll tell you when to stop.
Huh?
I'll tell you when to stop.
Okay, I'm going to walk away though.
All right.
Bye.